The MVP that we run in Central Lancashire is a group of service users, so that's from mums, dads, partners, and we sit together within a committee with the service providers and we make sure that we can get the service users to offer their feedback so that then we can co-produce and start changing the way that the maternity service is running, because at the end of the day obviously you can't put together a service without involving the people that that service is running for.
We try to use a grassroots approach, so we have MVP meetings. We get midwives to come in and present the women and their partners, share their experiences, good, bad, ugly, everything, and the midwives work with them in groups to try and hopefully transform that into something useful.
Our local MVP is really important to us at Lancashire Teaching Hospitals. We see them as true partners, pivotal in the work that we're doing here. If we don't get that continuous feedback, if we don't work in partnership, we've no guarantee that what we're providing and what we think we should be providing is actually meeting the needs of our population.
So I would say the benefits are we bring the voice of women and their families and their partners right to the core of how we're trying to run our service to make sure that we maximise the outcomes.
So everyone's got their different views, their different perspectives as to what actually makes a good service. And I think it's a really good way of bringing all those views together, because ultimately it's enabling services to be developed in a way that is actually useful and it has really good outcomes for the families.
From the clinical commissioning's point of view, we're committing to providing some resource, some financial support, actual manpower as well. But what we want to do is make sure that we have maternity services on the agenda at the clinical commissioning group.
DadsNet's a peer-to-peer support group. It's all based through Facebook. The MVPs have been brilliant for opening up the doors for DadsNet to get out there and get the voices heard, not just within the maternity industry, but also anything to do with children. It's kind of opened up this massive world where we can now offer a dad's voice and try and help in any way we can.
We've got a very strong, a very active MVP. We meet very regularly. We've got true buy-in from the maternity service, and I think that's really one of our strengths.
Listening to women and to service users does give us the insights that we want to improve services, provide better outcomes. And I think sometimes it's not just listening to what isn't going well, but listening to what is going well and building on that.
The work that we've done with maternity services, so we've looked at postnatal women and partners, was stating that they felt that the baby was no longer their own and that they'd have to do things because people told them to do it. We're bringing in a leaflet that's got concise information with regards to the choices that are available to the women. It's all about what it is, why it's there, why do we recommend it. It's at every aspect of you using your maternity services about your choice.
One of the challenges for the MVP is to make sure it's completely inclusive of all service users, and some of the challenges that we've had in that, for example, might be mums that are very young, mums that have got very complex medical histories, and we're getting better at trying to get out and recruit some of those women.
I've seen midwives sat in a room and listening to a woman directly sharing her experience is much more powerful than anybody else sharing it. Actually sitting and looking at that person whilst they're talking about what happened to them. I think it inspires midwives to go away, it inspires people who are involved in maternity services to go away and to make things better, or to continue what they're doing if it's already a really good service they're offering, just to continue that and see if they can push it further.